Thank you everyone for joining me. My blog is all about helping empower women. So today we are joined with Dr. Andrew Orr. He is the leading healthcare practitioner specialising in women's reproductive and health issues. This also includes endometriosis, and that's what we're here to talk about today. He has his own practice in Brisbane. Thank you, Dr. Andrew Orr, for joining me.
Thank you for inviting me.
Oh, my pleasure. So I know that we met just over 12 months ago at an endometriosis seminar on the South Coast. This day was so inspiring and so eye-opening to how many women actually do suffer from endometriosis. And it definitely made me want to research it more. As the host of the night, Mel Gregg, she also suffers from endometriosis, and she was telling us all her different stories that were also so very inspiring and motivating. So could you please inform us what exactly endometriosis is for those out there who do not know what it is?
Well, that's the $1,000,000 question. We actually don't know what endometriosis is or what starts it. We do know a few things about it, though. That we know that it's normal tissue that is growing in abnormal areas. So it's endometrial-like tissue that ends up outside the uterine environment. It can grow everywhere. It can grow in your lungs. It can grow around. You know, they've found it in your brain. They've found it in joints and other parts of the body. We also know that it's estrogen driven, so it's not caused from estrogen dominance like a lot of people say. So even small amounts of estrogen will drive the disease. And it's debilitating to a lot of people, but, you know, a significant portion of women with it actually don't know they have it either. So,
but they say diagnosis of endometriosis is found 7 to 10 years after, isn't it? And the numbers are quite crazy. 1 in 10 women actually do suffer from endometriosis, according to Endometriosis Australia. That's absolutely crazy.
Yeah, it is. And you brought up a good point. Yeah, it is often 7 to 10 years for diagnosis. And some women, it's even more. So a lot of women are being missed and dismissed along the way, one of the terms that I always use. But we say that 1 in 10 women are that's 1 in 10 women are diagnosed with it. So that means if a lot of them are taking up to 10 years to be diagnosed, that there's a whole lot of women out there that have it that don't. So I reckon that it's probably 5 out of 10. So half of women probably have it.
Yeah, I actually really agree with you, because me and my girlfriends were chatting about it just the other day, and my work colleagues as well. There seems to be a lot of women out there who have pretty common symptoms and who are coming forward and saying, yes, I do have endometriosis. I could count in that room definitely more than 5 people. So I just find it crazy that the number is only 1 out of 10.
Yeah.
So I agree with you in that regard. So what I've also wanted to ask was, what are some of the problems and issues endometriosis can cause from the early stages to the later stages?
Yeah, well, in the early stages, like period pain is one of the major, symptoms that women seem to have. Although we know that, as I said, significant portion of women actually don't get any pain or anything at all. But one of the things, we do see, women can have, painful periods, and then they have ovulation pain, they can have chronic fatigue, they can overlap with bowel and bladder issues. So a lot of women, get these UTI-like symptoms and they think they've got a urinary tract infection, but it's actually endometriosis causing all the inflammation. And we test the urine and there's no infection or bacteria. They can have pain on bowel movement. They can have lots of digestive symptoms. And as we saw with Mel Gregg, posting her endo belly and the digestive part of it, women can look like 9 months pregnant. And
yes, you can, absolutely. I know that I, for one, I definitely haven't been truly diagnosed with endometriosis. I certainly have, though, had symptoms, the signs of it. I have had the ultrasounds done, and I've definitely spoken to you a number of times for help and advice. So what advice can you give to women who don't know the symptoms, who are uneducated and don't know what's happening to them, when should they go seek help?
Well, the good thing, I suppose, when they first get their cycle, early intervention is the key to any disease. And as soon as you get, young women, and look, we know that teenagers aren't too young to be diagnosed. So young women, if we get them early enough, early intervention, and their first surgery should be their best surgery. And if we get them early enough, it could prevent the disease from growing. So the reason why a lot of women are in the problems they are in and the world of hurt they're in is because they've been misdiagnosed for so long. The disease has grown so much and become so problematic for them. Yeah. It's hard. Then they need multiple surgery upon multiple surgery. So the earlier you can intervene, the better. And you brought up a good part about ultrasounds and things. Ultrasounds can't diagnose endometriosis, and blood tests can't either. And there's very few sonographers that specialise in gynecology that could maybe pick it up on a scan. But these are special scans, high contrast ultrasounds as well. But they're not just your normal ultrasound places.
Yeah, of course. Well, it's so glad that they do have those the new technology that they can actually have that done. So regarding diagnosis then, is a laparoscopy absolutely necessary for diagnosis? Or can you just kind of say you have endometriosis? how does it work exactly?
Based on symptoms, and this is why I'm always dumbfounded that people take so long to be diagnosed, because there's clear-cut guidelines and clear-cut symptoms that point towards endometriosis. But the definitive diagnosis requires a laparoscopy, and at the time of the laparoscopy, they do histology, so they take biopsies and send it away to be tested, and then that'll confirm the disease as well. But once you can find the disease visually on a laparoscopy. Yes, it's confirmed.
Yeah, it's so interesting that they can do that. But I guess I want to know as well, if you have a laparoscopy done and the surgeon sees that you do have endometriosis, is it kind of two birds, one stone kind of thing? They can do the treatment then and there, or do you have to come back?
Yeah, it depends whether you're in the public or private system. But look, the main thing is seeing what we call an advanced trained laparoscopic surgeon. And so these guys are the guys that do extra surgical training on top of their gynecology training. And they're the elite surgeons, and they're the ones you want to see. And unfortunately, a lot of women don't see them. So they're called an advanced trained laparoscopic surgeon who specialises in the excision of endometriosis and other diseases. Right. So they're the ones, and what they will do when they find the disease, that's the diagnostics, and visualise it, and then they will actually excise the disease while they're there and any active lesions to, calm down a lot of those women's symptoms. It won't cure them, but it'll calm down the inflammation. Whereas if they went through the public system, a lot of public hospitals are training hospitals. So a lot of the first laparoscopies people have are just a diagnostic laparoscopy where they'll go in, have a look, and then don't do anything. They close them back up and bring them back for multiple surgeries so that surgeons can practice and train and learn about. And so they could end up having multiple surgeries that way, which often happens.
That's insane. It's so cruel, this disease. And, another thing I can't stress enough is, women really need to find a good doctor, one that they trust, one that won't brush them off and say things like, have a baby, that won't help at all. Because having a baby is not the solution. You have to have a baby for the right reasons. And once you do have a baby, endometriosis will still be there, wouldn't it?
Yeah, it is. And you're so right about finding the right person. So again, you've got to find a specialist that pretty much is an advanced trained laparoscopic surgeon, because if you've got endo, there's more than likely you're going to have to be diagnosed, and that requires lap. But, a lot of the GPs fail to refer on to. So I just tell people, go to your GP and say you need a referral to such and such. But you're right about the pregnancy part. Pregnancy will not cure endometriosis. All it does is give you 10 months of no cycle, and a lot of women get the associated, there's no period, so then they don't get a lot of the associated symptoms. And then maybe another 6, maybe up to 12 months while they're breastfeeding, till their period returns, and then it usually returns with a vengeance.
Yeah, I can imagine. It's a cruel cycle.
It's a very cruel cycle, and it's cruel to tell people these things that aren't the facts either.
Yeah. So sorry about that. I just had to put my phone on charge very quickly, so the setting might look a little different, but we're good now.
It's called improvising.
So the next thing that I guess I wanted to ask was the pill. What type of effects can the pill have on endometriosis? I know a lot of us women speak of, oh, when I was on the pill, I never had it. And as soon as I got off the pill, I had all these different symptoms and my hormones started changing, my body started changing. I started getting really bad period pain, really heavy periods. So could you please clarify what is the actual conversation regarding the pill and endometriosis?
Well, the problem with the pill is that the pill can provide, some good symptomatic relief for some women, and it depends on what kind of pill, because we know that, the endometriosis is estrogen driven. So a lot of women are put on combined pills with estrogen in it. Problem is, you mask the symptoms, and then also you've got that estrogen making it grow, and then you come off the pill, and then the symptoms are back again. And it's not that it made endometriosis come out, or anything. The endometriosis was there, and it's been masked. And that's what happens to a lot of young girls. They get period pain, they get put on the pill. The unfortunate part about that is there's often little regard for their future fertility. And then some women could be on the pill for, 20 years and then might, want to go and have children, then can't, because the disease has grown so much. Or it could make it more difficult. So it's more masking it. And if you are going to go on some form of contraception, it needs to be a progesterone only option, like a Mirena or an Implanon or progesterone only pill, and then combined with other, hormones.
Yeah. It's so interesting that you bring up other forms of contraception, because I know a lot of us women, we do need to have them, but we also don't want to have the other things that come with it, like the built-up hormones, and we don't want to have endometriosis. We don't want to, like you said, masking it. We don't want that to get worse. So it's really important, I think, to make sure you research and speak with your doctor about the best kind of form of contraception that is right for you and your body, and also your lifestyle, if you do want to start a family or not. So I think that's very important.
Yeah, it is.
Another thing that I wanted to touch base with is research, finding the right doctor. I know we're talking about some doctors brushing you off with having a baby, everything, but what about the other doctors? When do you know within yourself to go seek help and to go see the right doctor and make sure that you get the right opinions? Because I know for me, I always trust my gut. And if I'm not happy with one doctor, I will find the right doctor, next right doctor, until I know that it is the right one for me and I have all the information and education that I need. So what do you have to say about that?
Yeah, I think that's a good point to bring up. I think it's like any profession, we've got good and bad in every profession. And the thing is, we've got to stop thinking that GPs know everything, because GPs are general practitioners and they're there mostly to help with things like colds and flus and heart, and all that kind of stuff. They don't learn a lot of stuff about gynecology, and maybe only one subject, when they're at uni. So we can't expect them to know everything. But at the same time, they have, they need to be informed and they need to be educated. So if you're finding that your initial protocol, which will be a GP, isn't listening to you, then find someone else. The value of a second or third or 10th opinion is really good.
Yeah.
What I always tell people is that go and find the specialist, the endo specialist, and make sure they specialise in endo, make sure they're an advanced trained surgeon, and then just tell the GP, I need a referral to see them, and the specialist has asked me for the referral, and it makes it a lot easier.
Yeah, I completely agree with you. I couldn't stress about that more. So thank you for clarifying that. And out there, if you just need that little bit of extra advice. Okay, well, I guess the next thing I want to ask is diet and exercise. I know for me, diet and exercise and looking after myself is everything for my own optimal health. Do you think that eating the right foods and exercising and looking after mind, body, and soul I have this saying that says, smile in mind, smile in heart, smile on face. And I think that is so important to look after holistically all aspects of yourself and your life with women who do suffer from endometriosis, because they have to remember, you might have endometriosis, but you are not endometriosis. So you can still live a very long, fulfilling, happy life, but you just got to really maintain, have balance, and look after everything. What do you have to say about that?
Yeah, I agree. I think that's really important, the last bit that you just said there, that you aren't endometriosis, and so many people are actually living as though they are the disease, and they let the disease sort of conquer them, and they become more and more depressed, and then it's harder to reach them, harder to get them treatment, and it's just this vicious cycle that they're in. And it's a breaking free of that cycle, because we know that there are women, they can do it, you know, but it's that expectation versus reality, you know, step by step by step by step. And as long as you're moving one step forward, then you're doing well. You're not going to fix all in one go, but
baby steps.
Baby steps. And it's like when you go to the gym, you're not going to have a model's body or a buff body in 2 weeks' time. It takes a while. But endometriosis is an inflammatory disease. Now, how do we have inflammation? You know, what do? We need to reduce that inflammation. So how do we do that? Diet. We know a lot of our foods are inflammatory. You know, a lot of the high glycemic foods are inflammatory. Then we get excess body fat, which is inflammatory as well. So you need to lose the fat. So diet can help with that. And then exercise, increase blood flow into the pelvic cavity. And then that's good for the mind. And then the microbiome, so good bacteria. We know that good bacteria is good for our overall immunity. So we help our immune system, we help inflammation. And we also help our brain.
Yes.
That's the biggest one we all leave behind.
I'm a huge believer in meditation. I meditate every day, twice a day. And I can't stress about, yes, exactly. I can't stress about it enough to anyone. It really does work wonders. Once you learn how to master the mind, you can also become so much happier and freer within yourself. So I think by doing all of those things and light exercises to start off with, like Pilates, yoga, because that's all mindfulness and optimal health as well. So I think looking after, like you said, diet and blood flow and exercise and mindfulness, it really is everything.
And this is it. And people need to look outside the medical model, because we know, you know, surgery, and it's not putting that down. We know women with endo will need surgery, and they will need some form of medical intervention and painkillers and all that. But we also have a lot of women that are dependent on painkillers, and to the point they're addicts, and we need to, you know, get them off it. So we've got to support the whole structure. So this is why you need that team approach, that multimodality approach, a bit of everything. Yes, it's not going to cure you, but you can live a normal life. And there are women doing it every day. There's women, we see them, that are empowered. They get up, they do it. Yes. You'll have a bad day. You will have a bad day. I wrote a post about it tonight. You'll have a bad day, but you'll have more good days in the end.
Exactly. And that's what it's all about. You know, when life gives you lemons, you make lemonade. So if you have a bad day, you're human. Just means you got to get back on that horse, get back on your feet, and it'll just make you stronger for it. So I think that's a really important point.
Absolutely.
To put across. Yeah. Now I know also within your practice you use a lot of herbs and natural remedies for helping and healing women. Please tell me more about this, because I'm all for this, and I'm really excited to hear what you have to say about that.
Well, that's how I do my practice. It's a pure multimodality approach, using, you know, combining the Western medicine and the knowledge from that Western medicine, but also by combining, you know, dietary, lifestyle, you know, looking at mindfulness and all that. But the herbal medicine is a very important component. And we've got to remember that a lot of our drugs, you know, up to 60% of our drugs are actually come from a plant base. Yeah, and a lot of these herbs, like the Chinese medicine, will give you have been used for thousands of years, and there is a system, and they've been proven anecdotally to work. So they work on, you know, like antispasmodic. They work on nutrients, blood flow, which is so important. They work on that microcirculation. They help with inflammation. And they tailored to the individual. That's the most important bit, because even though while women have endometriosis, they all have different symptoms. So you've got to treat the individual if you want to get the best results.
Yeah, I love that. I think that's so great. Treat the individual, not the disease for what it is.
Exactly.
Yeah, I think that's so great.
Yeah.
I know that you mentioned before about women having endometriosis not only in the uterus, but their bowel, bladder, muscles, joints, lungs, and even the brain.
Yep.
How does that even happen?
We don't really know. I suppose it's like any other disease in the body. We think it might be traveling through the lymphatic system and ways through that, or fluids and, blood. It gets into the bloodstream. We don't really know how it spreads, but that's probably the best, that we can get to it. But it does spread. And I don't like using the C word, the cancer word, but it does act like cancer, and then it spreads through the body and it grows, and then the lesions grow, and they can end up everywhere. And they've found it in the brain, they've found it in joints and fingers, they've found it on the retina, and yeah, it's everywhere.
It's such a vicious cycle. Endometriosis, you really got to be so well educated and do your research and really trust your body. If you feel like something's not wrong and something's not right, you really have to listen to that and go seek help. So I guess the next question is, when would you advise a woman to go get help? When is far enough? Because obviously we don't want women to end up in hospital, because a lot of people brush it off and go, oh, I'll get better, oh, it's nothing. And then they do, unfortunately, end up in hospital, which we don't want that to happen. So when is the right time to go see your doctor?
Look, the main thing to get through women is period pain is not normal, and I think the best thing to do is get it when they're young. So as soon as you get your first period, or the first couple of periods, and it's continuously you're getting pain, then you need to do something about it. And we know, like I said, teenagers aren't too young. So it means getting onto it as soon as possible. The longer you leave it, the longer you can have issues, longer you have issues with the fertility. It's like any disease. The longer you leave it there, harder it is to treat.
Yeah, of course. I think that's a very important point to bring up as well. So I guess regarding support systems, where do women go for these support systems? I know that we've been speaking a lot about having the right group of doctors and the right people in your life. So who are and where are these support systems that women can turn to?
Yeah, and there is someone out there. Like myself, I do a lot of work on that and put out lots of blogs. But one of the best resources that I find is Endometriosis Australia, because it's about fat. And it's run by Jason Abbott, who's one of our leading laparoscopic surgeons, does a lot of research in endo, and it was also working at government level. A lot of people don't realise you actually have a male representing you at government level. So there's a lot of males like myself, but then the females behind the scene, like John Chichia, who runs Endo Australia herself, who's got endo, has got pericardial endo and thoracic endo. It's all through her body. So they're very focused on giving you the facts, and I think if you use that as your first port of call and support, places like Endo Australia, and then blogs like yourself and people that have anyone that's getting the information out there, support those people. Just be a little bit careful of some of the groups, because sometimes we get the groups together and then they're well-meaning. It's great to have the support, but then we also get a lot of self-diagnosis in there, and we get a lot of uneducated opinion because
Google diagnosis.
Yeah, and then they can live in the disease again, and it's all about the disease, and they're not being, what I mean? They're not empowering and get out there and
Exactly, yeah. And that's what I find, and that's why I also created this blog, is because I'm all about empowering women, creating awareness, educating people about diseases like this, because it is so important that women know exactly what is going on within their bodies. And that's why I love doing interviews like this with yourself, because it really helps get that message and awareness and education across, so women can actually feel empowered within themselves to go, you know what, I'm going to do something about this, and I'm going to really get myself sorted for the better, which I think is truly, truly important.
Yeah, and it's
and also having support from your partners as well, because I know that when we went to that endometriosis seminar, Mel Gregg was speaking about, you know, her and her partner every time. I know a lot of women don't speak about having sex, but it is so important to be able to speak about sex with your partner if you do have endometriosis, so they have that full understanding of what exactly is going on, because it can really be quite painful, can't it?
Yeah, it is. It's really important that males are educated just as much as females, so that they know that there are going to be days when their partner will say no, or they have to understand that sometimes they are actually having sex with their partner, and it's the partner's in pain and they won't tell them. And there's a lot of guilt for women too. So sometimes they'll have sex when they don't really want to, just because of the guilt factor. But then sex has there is that component too that can help with endometriosis by, you know, regulating blood flow, but it's more around climax and orgasm that helps with prostaglandins and oxytocin, the love drug.
Yes.
So there are ways you can modify your sex life, so it doesn't always have to be with intercourse, which can hurt women. There can be other things that you can do, and you know what, you can also it's about the connection, you know, it doesn't have to always be intercourse. And
exactly. Sometimes us women, when we are in pain, we really just want to have someone to hold us and say it's going to be okay. So on that level of
absolutely,
acknowledgement and affection as well, I think is so, so important. And I'm glad that you brought that up as well. So that's a really important thing for you women out there. Please never feel pressured. Always voice your opinion, and if you are in pain, go seek help, but always do what's right for your body. So I can't stress that enough.
Yeah. Absolutely.
I think on that note, we might start wrapping things up. So is there any last things that you wish to add to this about women and endometriosis?
No, look, the main thing is period pain's it's not normal. We've got to get that through. Things like hysterectomies don't cure endo. And early intervention is the key to any disease. So yeah, it's very, very important, and find the right person to help you and use a multi-modality approach. That's the best way to approach endo.
Yeah, I think it's a very healthy way of doing it right. Thank you again, Dr. Andrew Orr, for being a pleasure and for being so lovely and participating in this interview for my blog. I really appreciate it. I will have the link underneath to Endometriosis Australia for anyone who wants further information, wants to do a little bit of research. I'll put that down below. Thank you again, Andrew. You're amazing. Keep doing the amazing work that you do for women. Thank you.
Thank you very much.